Welcome back to the show, everyone. Always a pleasure to see our next guest and get updated on what is new and cool.
Absolutely. Dr. Frances Jang is joining us now. She's a dermatologist. How are you?
Great.
So it seems like we talk to you every few months. And every few months we talk to you, there's always new products when it comes to cosmetic dermatology. What are we talking about today?
Well, that's part of the fun of all of this, is that it's changing very rapidly, the scape. So a couple of things. Xeomin has now arrived in Canada. So that is the new Botox equivalent.
Ah, okay. So is there any difference in Botoxes?
Well, interestingly enough, there are some. This group of drugs is called neurotoxins.
Yeah.
They relax muscles when they're injected, and in the United States, they've got quite a variety of them now available for use, both in cosmetic and medical use. Yes. In Canada, however, we only have two.
Okay.
So we have Xeomin and the Botox, which we're familiar with. And actually, they're equivalents chemically. So they're both neurotoxin A, and they're neurotoxins B, et cetera, et cetera. But this is both neurotoxin A. So if you get 1 unit of Botox, you can have 1 unit of Xeomin.
I gotcha.
So whether or not that makes a difference to some people or not, we get some patients that the Botox that we conventionally use doesn't really last the anticipated 3 to 4 months. So perhaps for those people, this may last a little bit longer.
And have you noticed difference in the patients that you've used the new one on?
Not so far. We've done about 100 patients, but not so far. And it really makes sense that it doesn't make any difference because they are chemically identical.
Category.
Other than the conventional Botox has a little protein around it, which when we inject becomes dissociated. But what actually works at the muscular level is neurotoxin A.
And we're going to talk about a different kind of injectable along the lines of Restylane and Juvederm, which people have heard of. It's called Sculptra. So what is Sculptra?
Well, so there's another player entering the market. So most people are familiar with those terms that you've talked about. And they are products that are very safe, so they've enjoyed widespread use. And people would come in and we would inject it into creases and grooves where people were sunken.
So it's different from Botox? That Botox freezes the muscles?
Botox doesn't freeze, it relaxes a muscle and allows us to realign the muscles of facial expression. And it's preventative, so that if we, let's say, tend to frown a lot, we won't be able to frown as much, and we won't, if the patient continues doing it, it'll prevent that line from ever getting etched into the skin. So it's kind of a nice thing. You can prevent these lines from forming the face. So generally, we use Botox on the upper third of the face.
Okay.
That's not exclusive, but generally. And on the lower part of the face, conventionally, we're using these HA fillers, Restylane, Juvederm, and the like. Now we've come to understand that perhaps if you overdo this repetitively and allow this part of the structural framework of the face to age, that there becomes a disconnect. So what some people will observe is this overdone look.
Right. And I'm sure in people's minds there's a Rolodex of sort of Catwoman complex and all this kind of stuff.
And it makes sense because we're aging globally on the face. So with Sculptra is also an injectable, more recently approved in Canada, but having enjoyed widespread and long-term use in the United States because it was originally approved for use in the HIV patients who we all recognize get very thin in the face.
Yeah.
Right.
And it was actually designed to use in those patients. And then somebody had the bright idea, because it worked to make their faces look more normal. Somebody had the bright idea, well, if it works in those patients, normal patients as they age also get a form of lipoatrophy, atrophy of the face. So why can't we use it in normal aging faces to reverse that look?
Let's have a look at some examples using the Sculptra. We have our first one here, I believe.
And she's around 40-ish. And tell us what you've done on this patient here.
Before and afters, obviously, yeah.
So you can see this. So all the befores are on the left-hand side. We've got various angles. And you can see she's quite an attractive 43-year-old. But what's happening to her is she's just getting sort of this heavy, matronly, dare I say, look.
It's gravity, people. It's going to hit all of us.
But it doesn't have to, Fiona.
So what did you do and where did you put the Sculptra?
She was really loath to do anything unnatural. She is in a very public sort of workspace. And, but she realized that her face was not quite as youthful as it used to be. So we did a tiny little bit of Botox in between her eyebrows. So you can see that they're lifted after the treatment, 1 month after the treatment. And we also did an injection of Sculptra. And we focused on trying to reestablish the oval shape in her face by putting the Sculptra, which is a collagen stimulator, in her temple and in front of her ears and along her jawline. And it creates this wonderful lift. And this is right after the treatment. She's getting a massage, and this is part of the treatment where you have to massage the product 5 times a day for 5 days. So there's a little bit of work for the patient.
So does it just get it in there, or like make
gets
sure
it in there, keeps it smooth.
Good scientific terminology, Fiona.
Just
Gets
get
her
it
in there.
Dr. Jang.
Just gets it in there.
Her, in the reveal where she's, if you could hear the conversation,
She looks really happy.
She's happy.
She's very happy, and she sees the improvement immediately. But we always warn the patients, and in about 4 days, it's not going to look quite the same, because the saline, or the water that we use to inject the product in, is going to be gone. So she's going to look very natural. You can see she doesn't look overdone.
And downtime is really just redness
it's very
from the
minimal.
injections.
You can get bruising, but it's really not as much as I'm accustomed to with the hyaluronic acid fillers. So, and then she's got to wait 6 or 8 weeks to see the improvement, and then she's ready for her second session. So it's an incremental gain, and you can stop when the patient is happy. But you can see,
Very cool.
I think
Here's
the
number
next
2,
thing is we can see, so these are a couple of patients that actually have had Sculptra treatments, and I think you can appreciate that it's a very natural look.
Wow, yeah.
And I like using it in the very youngish age group, the woman on the left. There's nothing wrong with her face, but she comes in saying, you know, she was a pretty woman. She just notices
looks less tired.
Yeah, the bloom is off her face. This is what a term I like to use, because there's nothing wrong with this rose. So after a couple of sessions of Sculptra, you can see it's a very natural look, and she's only had Sculptra.
And how long, what's the sort of efficacy? How long does it last?
So it lasts about 2 years, because you're stimulating the collagen.
What?
Really?
And then a little bit of a touch-up. It won't be the same sort of number of treatments, but generally speaking, every decade, you need another session. So I'll be going for a long time.
Yeah, no kidding. That's incredible. I realize whenever we talk to you the entire interview, I'm always frowning. And it gets inside my head.
That.
Well,
she can
Michael,
fix that.
anytime.
Anytime. Is the bloom off my rose yet?
She's not answering.
I know. Wait a
You
second.
would like a consultation from Dr. Jang, you can go to her website to find out all the information on all the products and treatments that we were talking about today. Always nice to see you. Thank you so much.